This is the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we'll be talking about childhood cancers, and joining me on the program is Dr. Sherilyn Stanton, a consultant attached to the Pediatric Medicine Department of the Georgetown Public Hospital. Welcome to the program, Dr. Stanton. It is good to have you here.
Thank you for welcoming me here.
So we're talking about Children's Cancer Awareness Month, which is observed every year in the month of September. And we know that Childhood Cancer Awareness Month was made to raise awareness about cancer in children, which remains the leading cause of death by disease for children under the age of 14. Could you tell us about the importance of this month's observance?
Okay. So, childhood cancer is something that we often hear about, but lots of us don't know a lot about it. We often never think that it will happen to somebody that we know and somebody that we love, or even somebody that's close to us. However, as you mentioned, childhood cancer is one of the leading causes of death in our young upcoming lives. We need to pay attention to that particular aspect, because if we're going to achieve our development goals, then we need to ensure that we bring this number down, and we can do so by ensuring that we are aware of what are the potential causes and things that we may be able to do to reduce that.
Thank you, Dr. Stanton. What strategies have been adopted to monitor and treat childhood cancers in Guyana?
Okay. So, in Guyana and worldwide as well, we know that there are not many things that we can do to screen for cancer in this particular population. The reason being is that the particular types of cancer that are more prevalent, so the leukemias, brain cancers, lymphomas, there are no general screening measures that would be employed. There are certain familial disorders or certain genetic conditions that can be passed down from family member to family member, that in that family would require some form of screening to be done. However, again, because of the three top causes of cancer, not having any particular screening regimen anywhere in the world, it really relies on the parent being aware of what does my child look like and feel like when they're well, and then ensuring that they seek medical attention if there are any concerns. So if your child is not well or not getting better, the ideal thing would be to seek medical attention, and then at that point let the clinicians do the work for you.
Definitely. From the cancers you would have mentioned just now, which is the most prevalent here in Guyana, and what are some of the risk factors of that cancer?
Okay, so most prevalent in our population would be the acute leukemias. And again, it follows similar statistics around the world, where it covers roughly about 1/3 of all the cancers that occur in the childhood population. This is taking into account, however, that the pediatric population goes from birth to 18 in most centers. So, with that demographic in mind, the leukemias are the most prevalent.
Wonderful. I know that you guys have a well-developed pediatric department here at the Georgetown Public Hospital. Could you tell us of some of the services that you guys offer?
Okay. So, at our pediatric medicine department, we have a number of teams, and in particular, with regard to this area, we have a pediatric hematology and oncology service. In that service, we look at persons that not only have other forms of blood disorders but cancers as well. The team focuses not only on seeing those patients who are already diagnosed and managing them, giving them chemotherapy and the like, but also on investigating potential causes or potential patients that have cancer. And so we operate not only in a treatment measure, but also in an advisory capacity to be able to say, well, we suspect that this patient has a cancer. We would prefer that certain tests be done so that we can determine whether or not that is so. Um, in terms of our facilities and our structure here, we see kids that are less than 13 years old, and we have an area where we give chemotherapy. We have an area where we can isolate patients who are immune compromised because of their cancer or because they are receiving the chemotherapy. And then we have a follow-up program where persons who still have cancer but are on treatment can come be evaluated, have their blood work done, and then they can go home with their medication to use at home. On the other hand, as I mentioned, since we see those kids that are less than 13 years, there is that age group between 13 and 18 that our adult oncology services would manage. And so for their services, there's an adult oncology department. They see persons that have blood cancers as well as solid tumors, which are a little less prevalent than the blood disorders, but still quite prevalent as well.
Open water tanks are known breeding sites for mosquitoes. Always secure water tanks by covering them with a net and ensure all openings are sealed. And remember to regularly clean your tanks and prevent water from laying stagnant for too long.
Many potential mosquito breeding sites exist around your home and communities. Breeding sites are anything that can hold water. These include tubs, tins, buckets, tires, pools, tanks, bowl, vase, tree holes, plant pots, and even something as small as a cork is enough for mosquitoes to breed. So let's join the national effort and do our part to eliminate mosquito breeding sites.
For patients who've been diagnosed with some type of cancer, could you tell us how important is the support from family and parents? Tell us about that, the importance of that support.
So that's a really big area, and sometimes it kind of goes overlooked, or we don't pay as much focus on that. But management of any cancer should be holistic, where we not only think about having blood work done, giving chemotherapy, or having a surgery, or doing radiation and the like, but also what are the things that are going to make the quality of life of that child improved, or at least tolerable. Because we know chemotherapy and cancer treatment is not something that's easy. So family support is important because in most cases, when children are admitted, they would like to have a parent there or another family member who is there with them as they go through this treatment. For single parent families, you can tell that it's quite difficult, but if they have extended family members, they can also offer that help. It's a financial commitment as well, because for that parent, they would spend a lot of time in the hospital with their child and would not be able to go to work. Sometimes they may have other kids that they have to find caregivers for. And of course, the usual finances that you have to provide for your daily living. In terms of emotional support, the child has this big diagnosis to face. They don't understand sometimes, or sometimes they understand a part of it and they're scared. So they need that support not only of parents again, but of other family members. sometimes chemotherapy is not the easiest, and you don't want to eat, you feel upset, and all of that. So they need encouragement in terms of what are things that I can eat, what are things that I want to eat, um, and then how can the parent provide some of that. So in our facility here, we do provide meals for the patients and the parents, but then there are some things that the kids may like that you wouldn't get in a hospital situation. So um, again, having that family support is important. Um, in terms of the other aspect of it, there is some social support by the social workers that we have here. So having the discussion about the diagnosis in the first place is a difficult thing to do, not only for the clinicians to provide that information to parents, but for parents to accept it. And then how do we break that news to a child who was otherwise pretty well, maybe just a few months prior? They need that help, that counseling and support to get through that part of it. And then there may be things that they would like to share in terms of fears, wants. They may have expectations, and so the social workers that are here are equipped to discuss that with our children. And I think that's one of the areas that, although we have social workers, we would definitely encourage more persons to go in this area, because they need the support, and there are kids that are in areas that not just in Georgetown. So that's just a part of the
Yes, a collaborative effort is definitely needed. I think one of the important areas as well is mental health support, which I think is very integral with diagnosis of a cancer.
Yes. So again, kids, we always say in our department that children are not just tiny adults. And so at each stage of development, you expect different things to happen. Like kids at 5 years, they might be excited to go to a new school. Kids who are perhaps going towards their exams and thinking about going to high school, they're now faced with this diagnosis. What am I going to do in terms of studying? Will I go to school? Will I be able to have friends? Will my friends be able to visit me? And then all of those relationships that children would make and nurture during these years are obviously interrupted, because now they have to be in the hospital and they have to get chemotherapy, and they can't have that access to other children that they really need. So support in that regard is quite important. Support because lots of times they're isolated and they're alone, not just because they have this diagnosis, but because they're too sick to be around other people. So it can be a condition that's quite alienating in some aspects, but there's some forms of communication that you can offer somebody who has cancer. So talking to them on the phone, doing video chats, and thankfully we have those services that are available. And then there's internet services here, so the kids can connect electronically and talk with friends and things like that. In previous years, that wasn't there, so they were just in a room by themselves, and it was quite isolating. But now those are things that other folks can be able to do to reach out to them and to give them that support.
Wonderful. For parents who would have noticed a few different symptoms in their child, is there any screening available for them to come and test to know what's happening with their child?
So I would say if you've seen that your child is not well, maybe having a fever, not eating or losing weight, having night sweats, having pains or abnormal swellings, then you should seek medical attention. Some of the time, and a lot of the times actually, it may turn out to be something that's quite benign and maybe needs just a little bit of medical attention for that time, and there's no problem. In other cases, however, it turns out that this child has a cancer, and because they would have sought medical care at an early point, we were able to say, the medication is not doing what it's supposed to. It's definitely not just maybe a cold or a cough. Maybe it's just not vomiting and diarrhea or something like that. Maybe we need to do further testing to see what the problem is. So I would say ensuring that you listen to that voice inside of you that says, okay, my child is not well, I need to seek medical attention, would be the best thing, because there's no general screening that's available for most of the cancers.
Thank you, Dr. Stanton. Before we wrap up today's program, could you tell us about some of the future projections of the pediatric unit? What can we look forward to in the months ahead and years ahead?
Okay, so our plan is to expand our pediatric hematology and oncology services. We currently have a few isolation rooms where our patients are, but in the coming months to years, we expect to have our new hospital that's being built. So it's a pediatric hospital. We expect to have more rooms to accommodate those patients. There'll be a dedicated clinic area for them, and then we'll have additional services where those patients can get their transfusions and get their chemotherapy in an outpatient type setting, but safe from other potentially infectious diseases, and then be able to go home. So not all aspects of cancer care are daunting and require admission. And so once we have those facilities available, they should be able to come and comfortably get their outpatient care for their cancer.
Thank you for joining me on the program today.
Thank you for having me.
Dengue symptoms can range from mild to severe. Mild symptoms include fever, headaches, eye pains, muscle pains, joint pains, nausea, vomits, generalized weakness, and severe fatigue. Within a few days, a rash can appear. Severe symptoms include persistent vomiting and bleeding from any site. These sites can include the nose, a heavy menstrual cycle, and even blood in the urine or stool. If you are experiencing any of these symptoms, please seek medical attention urgently. Dengue testing is done with a blood test. These tests are available across Guyana. If you're experiencing any signs or symptoms of dengue, please seek medical attention and get tested. Severe forms of dengue, if left untreated, can be life-threatening.
Every year in September, the world celebrates or observes Childhood Cancer Awareness Month. This has been done since 1990, and now it's 33 years since the world have been observing this month as Childhood Cancer Awareness Month. Why Childhood Cancer Awareness Month? It's to raise awareness among the population about the importance of diagnosing early childhood cancers so that they can improve the survivability of these children and also to improve their prognosis. Childhood cancer is responsible for the most common cause of death among the child and adolescent population. That is the population between 1 to 19 years old. It is one of the most common cause of death among that population. In Guyana, we see the 5 most common childhood cancer include, the most common one is actually the leukemias, acute lymphoblastic leukemias, which account for about 69% of the cancers that we see in that population. There are other cancers, the things like the Willem's tumors, the neuroblastomas, acute myeloid leukemias, and which we see sometimes in children. The thing about cancers in children is that when we think about cancer, we more think about the adult. And we always report that about the cancer starts in adults. But the childhood cancer sometimes get neglected or sometimes is not brought to the forefront. But
childhood cancers is an important part because we are seeing more and more cases now in Guyana. In fact, about 0.1% of the cancers we're seeing in Guyana is actually due to childhood cancers. Why we need to raise awareness is that because many times when we see when a child is diagnosed with cancer, it's sometimes usually late, and that impacts on their prognosis. And so we wanted them to, persons or members of the public, to be aware that cancers do happen in children and in adolescent population. And sometimes a lot of the signs and symptoms are actually sometimes subtle, and they could be mistaken for some other minor illnesses. And a lot of time they do present with symptoms, but when they do get diagnosed, it is usually sometimes late. And this impacts on the prognosis in terms of what we can do for them in terms of treatment, or if we can help actually cure the cancer. There's no specific screening tests for childhood cancers in generally around the world, but a high degree of suspicion should be among the practitioners and also among the population. When you see a child might be presenting like persistent symptoms that are not going away, you should always raise the awareness that it could be a sign of cancer. And so among the population and among the healthcare practitioners, we want to raise awareness that they should be looking for these things because it is there, and then sometimes we miss the diagnosis. In terms of treatment for childhood cancers in Guyana, we do have some diagnostic capacity in terms of histology and scans that is available to make the diagnosis. Treatment is also available. We now at the Georgetown Hospital, we have an oncology unit, which is staffed by several oncologists. We recently acquired the services of one of our local doctors who has specialized training in childhood cancers and is now attached to the pediatric department. In terms of medication, we do have the medications for treatment of these cancers. And we also have in case for those who might need radiotherapy, that is available through the Cancer Institute. Survivability of childhood cancers in Guyana is like depends upon the cancer, it's like about 50%. And it all depends upon the type of cancer and also on how early we diagnose the cancers. There's also, for those cancers that are not able to treat in Guyana, the government also provides medical assistance in terms of financial assistance for those persons who need to go overseas to get treatment. And that is available at the Ministry of Health. Every year we do see requests coming from persons who need to go overseas to be treated for cancer, and then the ministry provides those financial assistance to those patients. We are doing more now than what we were able to do in the past. Oncology, our cancer in children, is still a growing program in Guyana, and we hope that we can, as we grow and we improve the health sector, the ability to treat and diagnose childhood cancers in Guyana will be one of the things that we will be able to get to achieve some of the goals that we set out. The entire focus will be to raise awareness among healthcare practitioners and also the general population that what are some of the things they should look for, and that to ensure that if someone is suspected, that they can be diagnosed and directed to the right facility.
Thank you for staying tuned with us. This was the Health Matters program, and I'm Alicia Martin saying goodbye for now.